to a day in the life of a dermatology PA. It's 7:45, time to head to work. Made it to work by 8, grabbing my coffee and my stuff and heading in to start seeing patients. And I'll also show you what I do at the beginning of every single day. It's super cold and windy out here today. Glad I'm going inside. First thing I do when I get here is track down a pen and a mask. I have only ever worked in dermatology, so I graduated PA school back in August of 2014, and I went straight into my first job working in derm. In that clinic, I worked 4 days a week, Monday through Thursday for the beginning, and then I added a half day on Fridays. So I was there for 5 years, and then I had a baby. What do you want to be when you grow up?
A PA.
So now that I have my daughter, I've switched to a part-time position. Now I work Mondays and Tuesdays from around 8 to 5. I see up to 35 patients a day can be on my schedule. Since I'm the newest provider and PA in the office, I will typically get a lot of new patients, which means more no-shows. So I would say I see right now around 27 patients a day usually. We'll have super busy days like yesterday and then more slow days like today. And so it just varies. I do a mix of medical, cosmetic, and surgical dermatology. On the medical side, I'm seeing patients with eczema, acne, rosacea, psoriasis, any type of skin lesion, warts, moles, molluscum. I'm doing skin checks, checking for skin cancer, and talking a lot about sun protection all day long, skincare regimens. On the cosmetic side, doing things like Botox and fillers. We also have some lasers in my office. Chemical peels are one of my favorite things to do, and just figuring out the best skincare for people. Which we do surgeries in our exam rooms. They're all set up to do procedures. I do all my own biopsies, so shave biopsies, punch biopsies, freezing things with liquid nitrogen. I'll show you my can at some point in this video. And then also excisions, which I love. I fell in love with surgery during my surgical rotation in PA school and loved being in the OR. And so getting to work in dermatology, I'm still able to do some of that. So if someone has a skin cancer or a cyst or an atypical mole, I can go in and excise it. That means cutting kind of a football shape usually around it and closing up that wound with stitches. So far, I'm 6.5 years into this, and I can't say that I'm bored yet. I've definitely had days of burnout or feeling overwhelmed, but overall, I love my job. I'm very happy with what I do. I'm happy in the role of a PA. I'm happy with dermatology. If I wasn't in dermatology, I would most likely be in a general surgery role or possibly endocrinology. I really enjoyed that when I was on rotations as well. But yeah, derm's fun. Not for everybody, but fun. Let's go on a tour of an exam room. So these are exam rooms. We have chairs for the patient, a little rolly chair. I do try to sit down with my patients. A little video with information that they can watch if they are waiting for a little bit. There is a TV in here. We don't really use that. Mirror if they want to fix their hair. Nice little windows that we keep closed when the patients are in here. A fancy chair that'll lay flat and go up and down so that we're not bending down as much, especially when we're doing surgeries or procedures. I'm terrible about that, trying to be better. Over here we have our electric cautery, and then this is where we're set up for doing a biopsy. So alcohol swab, gauze pad, lidocaine, some swabs. We'll put some Vaseline on there and some aluminum chloride to help with stopping any bleeding. And we use these little razors to do shave biopsies. And then our specimen cup where we put the specimen. So the medical assistant gets all that set up whenever we need to do a biopsy. A sink, soap, hazards, gloves, any tools we need, consents, pens, tissues, coupons, cards, hand sanitizer. Super exciting. In our drawers, we have all of our tools. So lots of different needle sizes. 18 gauge. I never stick somebody with an 18 gauge. This is fairly huge. I really only use these for drawing up medications or for millium. Let's see. We have a little 30 gauge. This is what we use to inject lidocaine. These are super tiny. You're gonna barely feel. We'll use those probably the most. More razors. These are teeny tiny syringes. These are actually used for insulin, but we use them for Botox. And then other syringes we use to pull stuff up. Down here, more specimen bottles, scissors for doing bandages. These are cautery tips here. So these go in the cautery machine to stop bleeding if we need to use those. And then tons of Band-Aids, which are essential for a dermatology office, and lots of different bandage sizes, as well as our cultures. So if somebody has a bacterial infection, we can do a culture, bags for the pathology, and then we rarely take blood pressure, but occasionally need to do that. Nothing too exciting in here. So cleaning supplies, trash can, and then a pillow and blanket if needed, and then just extra storage. And then up here we have drapes. So we use these during surgeries, extra consents, samples, and then surgical gloves for our kind of semi-sterile environment. And then this is more biopsy kits. We do lots of biopsies. This is tools for if we need to do like a punch biopsy. There aren't any kits in here right now, but we have all different size punches. So this is like a little cookie cutter. It takes a plug of skin out, and then we put in a couple stitches, and that gives us a full skin depth sample if needed. And then lots of different suture in different sizes and materials for biopsies or excisions if we need to use that. Up here, all we have are gowns and then our little pass out kit. So this is a juice box and crackers in case someone passes out. Kleenex, blankets. All right, let's see what else we got. Just bathrooms. My office actually has a hair salon and spa side. Let's see if we can go over there. So nobody's in here right now, but yeah, so it's pretty cool that we have a salon over here. And there's also 2 estheticians and a nurse who does cosmetic procedures also. Okay, this is a fun room because this is where our cosmetics are. So fillers, so fun. And then this is where we keep biologics and refrigerated things, and then lots of samples, different skincare that we have. And then I'll show you the other sample closet as well. I snuck away to an exam room to tell you a little bit more about what my day looks like. So I have my schedule right here, which has all my patients and what they're coming in for, what to expect, but sometimes it's not right, and that's okay. But that has all of what is happening for the day. And then I also will have my pathology. So when I do a biopsy, it will come in usually about a week later, and I can look at it, decide if it needs further surgery or if it's okay. And I also have dictations. So in our office, I dictate my notes. So I'll go see a patient. We have a pseudo paper chart EMR system. I see the patient, and then I come back out and I'll dictate their note. So once those dictations come in, I check them, make sure everything's correct, spelled right, what I want it to say, and then it goes into the note. Pretty straightforward. I like it. I like not having to stare at a computer screen, not letting that kind of get between me and my patient. And so I think it's a pretty nice system. Okay, I wanted to show y'all a couple of the tools that we use. So this is liquid nitrogen. It is super cold. We use this for warts, precancers, things called seborrheic keratoses. I don't know if you can see that. It sprays intensely. It does sting a little bit, but this pretty much goes in every patient room with me. The other thing I take with me is my dermatoscope. If you've ever been to a dermatology visit, they might have used one of these. Sometimes patients think that this is a magical tool that tells me whether something's skin cancer or not, but it really doesn't. This is just a magnifying glass with a light. So it helps me get a closer view on lesions to see if there's any atypia or funny looking cells or colors, but I keep this in my pocket. I typically don't wear a white coat. I usually wear my scrub jacket when I'm at work. It's just more comfortable. That's what pretty much everyone in my office wears. And my uniform is scrubs all the time. So that's what's in my pockets. And then, of course, unless I've lost them, pens. so many pins. And then we usually have kind of masks everywhere. I'm in a patient room, so I'm not wearing mine right now. But yeah, that's a little bit of what's in my pockets. All right, I'm officially home. It's about 4:30. I'm gonna go in, hang out with the family, make some dinner. And today's Tuesday, so it's technically my Friday. I hope you enjoyed seeing a little bit of what my day is like. If you enjoyed this, let me know, and maybe I'll try to see if I can show you more, maybe some patients, maybe some procedures. If you have any questions about how to become a PA, check out thepaplatform.com, and make sure to follow me on Instagram. I share a lot there on my stories at the PA Platform about what my job is like. Thanks for following along.